Jim Taylor, and this is my wife, Jerry. And Jerry was diagnosed first with MCI 9.5 years ago. And subsequently, when she became a participant in the aducanumab trial, she had a brain scan, PET scan, amyloid plaque on the brain, and the diagnosis was changed to Alzheimer's as she progressed. Jerry and I have always spoken 50-50 until recently, and her communication is more challenged at this point. So she corrects me whenever I make mistakes, but is often quiet other than that. So our diagnosis was not an easy situation for me. Jerry is a professional health. She has an RN and an MPH from Columbia, and spent her career in healthcare. So, and she's a double 4. She got a bad gene from each parent. So there's a number of Alzheimer's patients, people living with the disease in her family. So she was not as surprised by the diagnosis as I was.
My father was a practicing surgeon until about 20 years ago, when a neck injury, which was exacerbated in surgery, required him to step back from practicing medicine in that way. And he founded a center for the commitment to compassion and medical care at his hospital, which involved all sorts of wonderful programming. And it was actually out of that experience that we started talking with my college roommate about putting some of his writings into a book. But just as we were getting into a groove with that, my father suffered 2 strokes 3 months apart at the end of 2017. And that led to a lot of limitations for my dad, beginning with left neglect. So while he could see out of his left side, he didn't perceive it. And that meant that he was at a fall risk. And that began having 24-hour caregivers with him. And as if that weren't enough, a little over a year ago on New Year's Eve, 2020, my folks got the double whammy diagnosis of Parkinson's and early stage Alzheimer's.
Apparently she was in fairly good spirits, and we already knew that there was a dementia of one kind or another involved, because she had had this for about 7 years by the time we got around to diagnosing, and mostly that was because we were considering a facility. Because I think it's harder when it's your own parent and you see them like that, and you're kind of like more frustrated because you know they didn't used to be like that, and it's more annoying to you because they're not being who they used to be.
So my mother was diagnosed with Parkinson's in about 2015, 2016. And they said to us at that time that we could expect that there's about an 80 to 90% correlation that she would develop dementia. What complicated matters in her situation was that she was already cognitively impaired. So it was hard to judge what a baseline was and measure when things were starting, when the dementia had onset versus what was her normal cognitive impairment. In addition to her cognitive impairment, my mother was Korean, and her English was not her first language, and she was not literate in her native language of Korean. So she had all these issues that came out that impacted her cognitive state. So again, it was really hard to tell how much of it was dementia, how much was progressing, and how much was just her normal, everyday cognitive impairment.
Now, I'm here a week, at best every other month. It's very different than what it's like for my mom, who's here all the time. And she would say her life is also different because of these incredible caregivers that are also here with her and with my dad. But for all the bright spots, there's a lot of challenges. And for a man who was very independent and was a surgeon and a clinician and a researcher and a teacher and a writer, to continue to feel boxed in by some of these diagnoses is difficult. And he'll say that he really just wants to be of service. And my father can put on a very positive front and try to be in the moment and count his blessings, and begins every day with Hebrew blessings for waking up and for the food on his plate. And I think from my mother, who deals with the actuality of managing caregivers and doctors and trying to be his advocate and trying to figure out when more is more and when more is not more, and when to stop pushing so hard. It's a much harder challenge. It's easy for me to swoop in and out and spend quality time and then whoosh away. And I think it's much harder to be the online caregiver 24/7.
I think just allowing myself to be human and recognize my limitations it is so real and so human that I think it's incredibly important that any caregiver accept that responsibility willingly, and it's just the human condition in its most human form.
On the occasions now where I just go to the store for an hour or something like that, I can come back to mayhem. So that means that somebody really has to be here. So that's the biggest impact right now. We're getting ready in my office to go back to work in the office at least part of the week, starting in April. So I'm not sure what I'm gonna do, because on occasion I'll be here working and I'll hear the door click and she's gone out to check on her car to see if she locked it, or she wants to go get the trash cans in. And so she will sometimes not realize she hasn't kept the door unlocked. So if I wasn't here, she would have just locked herself out.
There's not enough resources, I think, put towards that, the well-being and the care of the healthcare provider or the caretaker. I don't think enough emphasis is put on that. That if you're not taking care of yourself and your well-being, you're not able to take care of anybody.
You were saying recently that you have just a hard time even with the word dementia and Alzheimer's. Can you talk a little about why those words feel so hard? Because you've spoken to people about, I've had strokes, even I have Parkinson's, but dementia and Alzheimer's really just...
It's been hard accepting my limitations and wanting just to think of myself as being limited. It's been very complicated for me.
And especially something related to the brain?
Yes.
Even more so than the body, because with the stroke and with Parkinson's, there have been movement limitations, but it seems like the brain, the cognitive being impacted has been particularly chilling.
Quite so.
Thing that he does is he lets me be me, and he is not ahead of me or back of me. He is able to figure out if he's going too far or he's being too coddling, and that allows me to be me, and we as a couple can continue be as much as we possibly can, with the fact being that in fact my brain is different. There is different thoughts, and that's it takes a bit of work, and it takes a lot of changing from both of us. And but that happens across the course of life. things happen, and it doesn't stay just the same.
The things I'd like to tell everybody with the disease is there's a choice in how you live with this disease. You can choose to realize that you have been given a number of years ahead of you that can be joyful, purposeful. The person with the disease is somewhat more forgetful. But remember, this is a long-term disease. Many people live over 10 years, 10 to 15 years or longer. And the early stage and mid stage can be a wonderful time of life. And we've been giving a diagnosis, so that makes every day more valuable. So grab it, choose it, live it fully. Mark things off your bucket list. Contribute to others. I mean, for us, the most rewarding and joyful part of this has been our advocacy and our ability to help other individuals with dementia.
The silver lining, while it sounds really maybe cold and unfeeling, is you can't get your affairs in order soon enough. Do your will, do your living will, do your most, do your power of attorney, get your affairs in order, make sure that you're living in a situation that's the safest and healthiest for you and for your family members and for your loved ones. I think that's really, really important. And you think there's always time. Oh, I'll have time to do a will. I'll have time to do that. I'll have time to, this is too early. You just can't do it early enough. And that's really what I've learned from it, because all the physical stuff you can't control. You can take medication up to a certain point, right? That might or might not help slow down or stabilize your condition, but you can't control the acceleration or the decline of your health to some extent, but you can control some other factors that might make living with that situation a little bit easier. There is some good in the experience, okay? It sounds like it's all awful and emotionally draining, but there is some good learnings from something like this. It does make you a more compassionate person. It does make you question your mortality and how do you want to live the rest of your life and what's important to you. And I think that's a good thing.
I guess the other thing is to forgive them. These behaviors are classic dementia behaviors. That's what a person with dementia does. So forgive them for having dementia. It's quite likely not their fault. So that makes things a little lighter.
So one label does not one size fit all.
I don't think so.
And I know you want to be seen in your totality.
Yes.
You don't want to be labeled, he's X. Are there better words that you can think of? How would you want someone to talk about those cognitive challenges?
I think that's a great question, and I don't know how to answer that.
But you're more than just a label.
Thank you.
Keep working. What else?
Well, the first thing I'd say is, from the bottom of our hearts, thank you. I don't think they hear that nearly often enough. They're giving parts of their life, their careers, trying to find a cure for our granddaughter, and nothing means more to us than that. And so we are tremendously grateful to researchers and clinicians and people who are involved in the field. And I think as people who are impacted by the disease, we need to express that gratitude more profoundly and more often. And secondly, remember that, we are a continuum, but it's a continuum of a disease, start to late stage. We have lots of ideas and advantages, and we can promote clinical trials, and we can help you. But we're so rarely asked. We're rarely asked, well, what are your ideas about recruiting additional trial participants? Or what do you think of this procedure versus that procedure if we're designing the next clinical trial? Jerry's a brilliant person, and she didn't lose her brilliance when somebody told her she had MCI. So I would encourage scientists to realize what a wealth of resource they have in their patients and in their care partners. Take advantage of us. That by asking us, don't hesitate, because if you don't ask us, you deny us the opportunity to feel valuable, to feel like we can help, to get the positive psychological benefit of helping and the fight to find a cure.